Chair recognizes the gentleman from Bullock 26 for explanation of the bill and a motion thereon.
Thank you, Mr. Speaker. This may be a cloudy day outdoors, but this is a good day in the Commonwealth because today, after 7 years of debating this bill and having versions filed in the House and the Senate, we now come today with Senate Bill 94, which is a compromise piece of legislation that has been worked out with the Kentucky Nurses Association and nurse midwives and the Kentucky Medical Association. As I said, this bill has been debated and discussed at length, and today we bring a bill that resulted in months of serious negotiations, and today we can finally pass this bill. Before I summarize the main points of Senate Bill, I want to remind all folks here that advanced practice registered nurses, or APRNs as they are referred to, have been given prescriptive authority for controlled substances since 2006, a bill passed by the Kentucky General Assembly. There are limitations in that bill, which include a 72-hour limit for Schedule II drugs like oxycodone, and those are not changed in this bill. They remain in place. The 2006 legislation required a collaborative agreement for prescriptive authority, for controlled substances, shortened to the CAPA-CS. Senate Bill 94 seeks to improve the structure and communication between APRNs and the physician that they will sign this collaborative agreement with. It'll include mandatory meetings at greater frequency for individuals who are in their first year as a nurse practitioner. They will have quarterly meetings, and after that, for the next 2 to 4 years that they are in practice, they will meet twice per year to look over the reverse CASPER report for the APRN and examine their records. Mr. Speaker, ladies and gentlemen of the House, this bill, if passed, will assure that an APRN, when they are practicing in the state, will have to have a current DEA registration number from the Drug Enforcement Administration, and they will maintain their registration with the CASPER system. There are built-in mechanisms in this bill to protect our Commonwealth from the overprescribing of controlled substances. We may ask today, how does this help, this bill? How does this help Kentuckians? Being able to prescribe without having a CAPA-CS will address several problems that APRNs and their patients have encountered. These include difficulty in getting credentialed by insurers and MCOs, being unable to provide medication-assisted treatment for opioid-addicted Kentuckians, and the fear of opening a practice because of the potential loss of the CAPA-CS, and with it, the DEA number. Senate Bill 94 will remove these barriers to care and allow more APRNs to open their own practices all over the Commonwealth. This bill also sets up the Controlled Substance Prescribing Council that will be chaired by the Office of the Inspector General. The Inspector General himself will chair it and will include the Executive Director of the Office of Drug Control Policy. In addition, this board will communicate with the Legislative Research Commission and the respective bodies, the respective committees in this body that would oversee this issue. They will report on an annual basis as I said, to the legislative committees of jurisdiction and to the governor. This council is needed and will provide some valuable and informative data for us to move forward in our battle to address the problem of controlled substances in the Commonwealth. Mr. Speaker, ladies and gentlemen, now is the opportunity to pass good, solid policy that will give us assurance that controlled substance prescribing and dispensing is being reviewed with transparency and accountability while also increasing access to quality health care. I congratulate the physicians and the nurse practitioners for their hard work to make this agreement happen and for bringing us a solid, well thought out bill. Mr. Speaker, at this time I now move for the passage of Senate Bill 94.